Hi, my name is Kweku. I'm a pharmacist. Today I'll be reviewing a newly approved medication called Journavix, which has the generic name suzetrigine. We'll cover what it is, its uses, how it works, dosing information, how to take it properly, important precautions, and some side effects that you should be aware of. Before we dig any deeper though, I just want to emphasize that this video is for educational purposes only. The information that I'm sharing shouldn't replace your doctor's advice. Like I always say, do not start, stop, or make any changes to your medication regimen without first consulting your doctor. So what is Journavix? Well, Journavix or suzetrigine is a first-in-class non-opioid pain medication that was approved by the FDA in 2025, January 2025. Now that's significant because it represents the first new class of pain medications approved in more than 20 years. Now, what makes Journavix particularly noteworthy is that it's effective for moderate to severe pain, but doesn't have the addictive potential associated with opioid medications. So what is Journavix approved for? Well, Journavix is specifically approved for treating moderate to severe acute pain in adults. Now, acute pain is short-term pain, often following an injury or surgery or any other sudden onset painful condition. It is not intended for long-term or chronic pain management. And as of right now, it is only approved for use in adults, not children or even adolescents. So how does Journavix work? Well, what makes Journavix special is its unique mechanism of action. Unlike opioids, which work by affecting receptors in the brain, Journavix targets pain signals before they even reach the brain. Now, to better understand it, imagine your nerves as electrical wires that transmit pain messages from the injured areas to your brain. Now, these messages travel through special channels called sodium channels. Jonavix specifically blocks a type of these channels known as NaV 1.8, which are primarily found in the nerves outside your brain and spinal cord. So by blocking these channels, Journavix prevents pain signals from reaching your brain in the first place, so you don't feel the pain as intensely or even at all. This peripheral mechanism is significant because it means Journavix doesn't affect the brain directly, which is why it doesn't have the same addictive potential like the opioids. Now, how to take Journavix correctly? Well, Jonavix comes as oral tablets, and the dosing is a bit different from any of the other pain medications. Now, here's how it works. The starting dose is 100 milligrams, and this first dose should be taken on an empty stomach, at least 1 hour before eating or 2 hours after eating. Now, doing it this way ensures that the medication starts working more quickly. Now, the manufacturer recommends that you can drink clear liquids like water, tea, or black coffee during this time. After the first dose, the typical dosage is 50 milligrams taken every 12 hours for as long as your doctor recommends. Now, these subsequent doses can be taken with or without food. Now, there are also a couple of other important points to know about taking Journavix. Firstly, you should avoid grapefruit and grapefruit juice while taking this medication. Grapefruit can interact with Journavix and increase the risk of side effects. The second thing is that the tablets should be swallowed whole. They are not supposed to be crushed, chewed, or broken. So common question, when do you expect results? Well, Journavix begins to work relatively quickly, especially when the first dose is taken on an empty stomach as directed. Many people experience pain relief within the first few hours after taking the first dose. Now let's talk about some important precautions. As with any medication, there are several things or important precautions that you need to be aware of. And the main one is liver problems. If you have liver issues, particularly moderate to severe liver impairment, you may have an increased risk of side effects from Journavix. So your doctor obviously should know about any history over there, and that would inform his decision to decide whether Journavix is actually, if you're a good candidate for Journavix. Now let's talk about drug interactions. Journavix can interact with a number of medications. It's especially important not to take Journavix with what we call strong CYP3A inhibitors. Now these are medications that affect how your body processes certain other drugs. Now these include antibiotics like clarithromycin or azithromycin, antifungal medications like ketoconazole, and some HIV medications. Journavix should not be taken with these strong CYP3A inhibitors. So always tell your doctor or your pharmacist about all other medications and even supplements and vitamins that you're taking. The next group of medications are birth control medications. Jonavix may make some hormonal birth control methods less effective. If your birth controls contain progestins other than levonorgestrel or norethindrone, you may need to use some non-hormonal contraceptives such as maybe a condom or additional form of contraception while taking Journavix, and for 28 days after stopping it. Now, another group of people that need to be careful are pregnant women or breastfeeding women. It's not known if Jonavix can harm an unborn baby or if it passes into breast milk. So if you're pregnant or planning to become pregnant or you're breastfeeding, be sure to discuss this with your doctor. Now, talking about pregnancy, Jonavix may temporarily reduce fertility in females while taking this medication. So if you have concerns about becoming pregnant, definitely discuss that with your doctor before you even start on Jonavix. Now, let's talk about some potential side effects. Well, Journavix seems to have a relatively short side effect profile, which I guess is good news. The most commonly reported side effects during the clinical trials included itching, muscle spasms, increased blood levels of a protein called creatine phosphokinase or CPK. Now, if you're curious, other medications that can also potentially increase this CPK include statins, some beta blockers, and certain antibiotics. Other reported side effects include a rash. Now, as with any medication, it's important to take Journavix exactly as prescribed by your doctor and be aware of some of these side effects so you can have and drug interactions so that you can have meaningful discussions with your doctor. I sincerely hope you found some value in this video. If you did, please give it a thumbs up, share with somebody else, and like I always say, stay blessed, and I'll catch you in the next video.